Good morning, students.
Good morning, sir.
Yes, Gomadi.
Good morning, sir.
Yes, Nikhila.
Good morning.
Good
Mouse.
morning, sir.
Yes. Anisha. Study of population. Previous class we had been learned that overpopulation, population trend, population theories. Today we have to start with population explosion in India and its impact on health. What do you think about explosion means rapid or unexpected growth, which is directly impact on people physical health, mental health and social well-being. Meaning rapid population growth. Definition: geometric expansion of biological population, especially unchecked growth in human population resulting from decrease in infant mortality and increase in longevity. Keywords: geometric expansion, unchecked growth, which means cannot control due to mainly decrease the infant mortality and increase longevity, which means life expectancy may be increasing. So these are the conditions called population explosion. Look at this picture. The population have been explored. Here one of the pictogram available. Can you see that? Population of Indian states matching that of large countries is amazing data. For example, Uttar Pradesh, 183 million, same as Brazil. Maharashtra, same as Mexico. Bihar, Germany. West Bengal, Vietnam. Andhra Pradesh, Philippines. Maharashtra, Thailand. Tamil Nadu, France. Rajasthan, Italy. Gujarat, South Africa. Orissa, Argentina. Kerala, Canada. Jharkhand, Uganda. Assam, Uzbekistan. Punjab, Peru. Haryana, Romania. Delhi, Cambodia. Like this, every Indian state population is as a country's population in the world. So just imagine Indian population is how much? overpopulation scale, World Bank, World Development Indicators. In 1960, the population is that around below 0.6 billion. 2010, 1.2 billion. So what happened here? Around within 40 years, 50 years, Indian population became double. So this is a phenomenon of population explosion. So in the examination should be draw this graph. Next we have seen that one of the map, Indian map, explaining about percentage of population growth. Already we had seen that in population trend. The fact is that North Indian population growth is higher than South Indian population. Due to various reasons, mainly education and people lifestyle. The first factor is that the educational factors, people awareness regarding it. Then factors responsible for rapid population growth in India. First, social factors, including early age of marriage. Next, illiteracy. Mainly female literacy is very less, lower. Then economic factors, occupation, industrial sector. Then demographic factors, large base population mainly, which means already we have lot of population. So low death rate can explore the population. Then family planning in 1952. But birth rate still high. Reason is that the aim of family planning is that safe motherhood and safe childhood. So reducing the maternal mortality and infant mortality. So which cause to explore the population. Reason for the growth of population. First reason, declined death rate. Due to control of mortality, including infant and maternal mortality. Then control of famine and away from food crisis. And mainly the facilities are available now, medical facilities, improving medicine. Then universality of marriage. In Indian culture is that everyone should be married. Then only society accept normally. Next, 50% of population depends on working population, which means 50% children as well as elders, mainly children. High infant mortality, fifth one, induce the parents to produce more children. Look at this urban health matters, mainly urban India, population explore. Sixth reason, poverty and economic backwardness. The poverty leads to illiteracy, unemployment, and which cause to economic backwardness. Then illiteracy. Then migration, mainly migration from village to city. Then political instability. The government difficult to formulate program and policies due to instability of government. Then urbanization, overgrowth or unstable, imbalanced growth of cities, industrialization, mechanization. Also should be think about computerization. So these are the reason why the growth of population become explored in India. Then evil effects. First is that national income, GDP. is rapid growth of population heavily strain on our economy. Government difficult to formulate the program due to lack of money. And the reason is that unexpected growth of population. Look at this, water problems are there. Then change in environment, pollution, mainly climate change, soil pollution, air pollution, water pollution, which cause global warming, climate change. Mainly in cities should be think about noise pollution. Then educational facilities, food problems, unemployment, healthcare problems, law and which means law and order problems, problem of housing and corruption. No, corruption is a major issue in India. It's difficult to eliminate due to various reasons. The political structure. Then climate change, etc. So these are the effect due to overpopulation or population explosion. Global warming already we have discussed. Then impact on health status. It has been effect on physical health, cause communicable diseases as well as non-communicable diseases. Mainly new types of diseases. Then mental health. The people suffer from depression, stress. Then social disorders, mainly social disabilities, religious disabilities, and relationship problems, etc. It's also induced diseases, communicable diseases, new types of diseases which is difficult to diagnose. The non-communicable diseases. Then disorders including deviances, urbanization, induced psychosis, substance abuse, alcoholism, crime, delinquency, vandalism, damages, family disintegration, alienation, which means abnormal life, unstable life. So we need population control to prevent explosion of population. How to control it? Detail going. Definition: human population control is the practice of artificially altering the rate of growth of human population. So key word is that practice of artificially alter, which means they try to control by means of using various means of social population control. Need for population control. First need is that changing economic, social, cultural pattern. Then maintain quality of life criteria. Then raise standard of living. Then adequate shelter, education, medical care. Next need is that to control the antisocial behavior. Then reduce social problems, mainly poverty, unemployment, illiteracy. Then prevent crowding, mainly in city concern, to small and healthy families. Measures of population control in India. There are three measures: social measures, economic measures, and other measures. The social measures including minimum age of marriage. Age of marriage should be increased. That's why government nowadays try to change that. Then raising the status of women, which is very important. Women's status, mainly economic status, should be increased. Then spread of education. Education is a fundamental. Then adaptation, which means this, if any couple having no child should be adopt the child, do not remarry. For example, in orphanages, adopt a child legally. Then change in social outlook regarding population. Then social security measures. They protect people away from social issues. Then religious leaders has to advise small family norms. For example, various religions, they not aware about the family planning. So religious leaders educate or advise, moral advice to reducing the family size. B. Economic measures. More employment opportunities, development of agriculture and industry, standard of living should be increased, urbanization and industrialization should be controlled or balanced, and rise in rise in per capita income, which means a person should be earn money, is enough money should be earned. Next, other measures: late marriage, self-control, family planning, recreational facilities, publicity, publicity through media, then incentives. So incentive, for example, one girl in one family, the government provide a child welfare programs, free and fair education. If you know that is a family having only one child, which is girl child, free and fair education and scholarship and education as well as, which is a financial incentive as well. Then employment of women. These are the other measures. Some of the family planning facilities, lowering infant mortality rate, urbanization and industrialization, family welfare and family planning programs, mass media has to be used, legitimate enactment in parliament, which means new law need to control the population. Then use contraceptives, birth control devices, so which is very, very important for the control the population. Every individual or every woman know how to control, how to use the contraceptives. Look at some of the methods of prevent the population use intrauterine device, IUD. Example, copper IUD. Then oral contraceptives, condoms, condom. So students, this is a modern method. Look at this. Subdermal implantation, which means implant under the skin to prevent unnecessary pregnancy. So there is no side effects. So easy to remove it and try to other child. So there is no, which is modern method to prevent unnecessary pregnancies. So all other methods are available. Every methods having side effect as well as disadvantages as well as advantages. The role of nurse to control population. The nurses doing fundamental role, in village level, family level, health education, mainly individual level. When a patient come into hospital, a department of gynecology, the nursing specially trained nurses educate the mother how to control the population unnecessary pregnancy and how to make space between the two child, how to increase happiness in this, which means happier motherhood. Then counseling, client-oriented counseling. Then administration of birth control devices, which is important. For example, administration of drugs, male contraceptives, then properties and condoms distribution to the families. Then administration of contraceptives, then organize awareness program, then encourage community and people participation, mainly awareness program in college level as well as community level, and create a people participation to control the population. So fact is that nurses doing fundamental role to control the population. Next is that family welfare program in India. Define family welfare. The program develop the well-being of individuals. What are the individuals in the family? Child, woman, elders in family through welfare measures. Keywords: well-being of family members or individuals through welfare measures. In India launched National Family Planning Program in 1951. So the family welfare started in beginning the name of family planning. Then only change, detail going on. Goals of family welfare: reduce IMR, infant mortality rate. Students, this is a expansion is very important. Every nurses need to know this. Then control MMR, maternal mortality rate. Then minimize TFR, total fertility rate. Then 5-year plan and family welfare. Each 5-year plan having considerable measures taken to control and allotment of fund to family welfare. The objectives of 5th 5-year plan was birth rate to 30 per thousand. Then by increasing the integration of family planning services, then maternal and child health and nutrition. New policy in 1977, name of the family, which means name of the family planning change into family welfare. Student, this is important question, maybe competitive examination ask this question. The name, the family planning program change into family welfare. So nowadays, the family planning is part of family welfare. Functions of Department of Family Welfare: facilitate antenatal natal services for pregnant women. Second, to implementation of postnatal programs. Then provision, family planning services, mainly basket, contraceptives, female-male sterilization, mainly condoms, and etc. given to mainly these nutritional services also provided. Folic acid. Next, implementation of UIP, Universal Immunization Program, for mothers as well as child. Then surveillance of VPD, vaccine preventable diseases. Then implementation of pulse polio program. Next, implementation of PC and PNDT, pre-consumption and Prenatal Diagnostic Technique Act 1994. Student, this is a landmark legislation to prevent this, look at this, prevent sex selection. We know that modern technology can see the sex in the womb. So according to this legislation, this is a confidential. Any doctors or nurses break the confidence or support to the sex selection is a crime, is a punishable crime. Then MTP, Medical Termination of Pregnancy Act. So this is a legislation to prevent unnecessary abortions. A normal woman not allowed to abortion. So this legislation listed what are the conditions allowed to abortion. So these are the concerned by family welfare department. Next, coordination and expansion of activities through mass education. Then procurement of specific vaccinations to monitor performance and quality of family welfare activities by NGOs and release grant in aid. Students, we need to think about it. For example, in India, mainly maximum of government family welfare program implemented through NGOs, non-governmental organizations or private hospitals. So this Department of Family Welfare is evaluate that every NGOs and how much and what are the programs they launch or implement by the private hospitals or non-governmental healthcare organizations and allowed to release fund to that hospitals, mainly family planning as well as other related facilities. Then facilitate provision of adolescent health, which is very important. You know, adolescent, WHO says that adolescent adolescent health is totally different from others' health. So the reason is that transition period from childhood to adult and need special attention to promote welfare of adolescent. Then capacity building, training give to the healthcare professionals and allied professionals. Then family planning we will learn next class. Students, fact is that family planning is part of family welfare. Look at this picture, no logo. One family, one child. They emphasize girl child. If a family having a girl child, lot of incentives, mainly scholarship for that child. Detail will be next class. Now discussion time. Okay. Okay, students, I wish you all happy Christmas. I wish you all happy Christmas. Have a wonderful day. Yes. Okay.
Thank you, sir.
Thank you. Thank you, everyone.
Thank you, sir.
Okay. Next class. Okay. Nikhila.
Thank you, sir.
Resma, yes.
Thank you, sir.
Asha Georges.